Welcome to Transcend Awards. Legal duties in gymnastics environments. Prioritize legal duties. Your learning objectives are to be aware of duty to comply with legislation, to be aware of duty to comply with statutory guidance, to be aware of duty to comply with infection control policy, to be aware of duties of the gymnastics venue operator, to be aware of own duties in gymnastics environments, duty to comply with legislation. Legislation is relevant to all citizens and organisations. Gymnastics venue operators, hirers and individuals must abide by a significant amount which is relevant to the nature of their work, their customer, staff and other stakeholders. Legislation relevant to gymnastics environments include, but is not limited to, the Health and Safety at Work Act 1974, the Data Protection Act 2018, the Children's Act 2004, the Equality Act 2010, the Control of Substances Hazardous to Health Regulations or COSH, the Public Health Act 1961, Reporting of Injuries, Diseases and Dangerous Occurrences Regulations or RIDDOR, the Human Rights Act 1998. Legislation compliance in regards to the gymnastics environment is highly complex as pieces of legislation are interrelated. There are times when there may be a need to prioritise one piece of legislation over another. For example, during times of a health, safety or infectious disease concern or crisis. This is made clear in the statutory guidance and must be justifiable. Duty to comply with statutory guidance. The Department for Digital, Culture, Media and Sport, known as DCMS, is a department of Her Majesty's Government responsible for growth, enriching lives and promoting Britain abroad. DCMS publish a significant amount of statutory guidance that sets out what sport and leisure facilities, athletes and providers must do to comply with the law and statutory guidance. The DCMS confirm that you should follow the guidance unless you have a very good reason not to. Statutory guidance for gymnastics, leisure and sports facilities contains critical information which relate to health, safety and infection control. Recent industry guidance embeds information on safe practice in direct response to the coronavirus pandemic. This guidance is being regularly updated and gymnastics venue operators and external hirers have a duty to monitor and comply. Duty to comply with statutory guidance. Gymnastics venue operators and hirers are also answerable to other relevant regulatory bodies such as Public Health England. Public Health England are an executive agency of the Department of Health and Social Care in the United Kingdom. The Health and Safety Executive. The Health and Safety Executive are the national independent regulator for health and safety in the workplace. CIMSPA, the professional body for the UK sport and physical activity sector, the Chartered Institute for the Management of Sport and Physical Activity, support, develop and enable professionals to succeed and inspire our nation to become more active. It is recommended that the statutory guidance as set out by regulators is all considered when setting and complying with policy associated with infection prevention, mitigation and management in the gymnastics environment. Duty to comply with infectious disease policy. Gymnastics environments are common sites for transmission of infections because Young children are the primary users with immature immune systems, with parents and spectators also present, increasing the volume of individuals in the environment. Naturally, less protective clothing, more skin contact, and a variety of equipment and cleanliness of storage and use. Contamination through changing areas and poorly cleaned facilities. Close proximity of participants and physical handling or contact may be required for physical skills and safety. Gymnastic venue operators, external hirers and users therefore have a legal duty to ensure the spread of infectious disease in the gymnastics environment is minimised through safe systems and practices. Safe systems refers to the policies, practices and training that is provided within the workforce structure and for customers to follow. Duty of the operator and external hirers. Under the Health and Safety at Work Act 1974, the accountability for the health and safety within the gymnastics environment lies with the operator. It is essential, therefore, to be aware of who the operator is to ensure you engage with the right policies and practices with regard to health, safety and infection control in the gymnastics environment. The operator is responsible for the health and safety of all employees, external hirers, gymnasts and other people on the premises. The external hirer is classed as the employer in academies, clubs and private providers. These employers are responsible for publishing their own policies and procedures on health and safety in line with statutory guidance and with the influence and guidelines laid out by the venue operator from which they are hiring the facility, as well as their governing body organisations. Infection control and contingency plans must be aligned to statutory guidance and must fall within the health and safety policies and practices for each operator, external hirer and gymnastic environment. Duty of the operator and external hirers. Each operator must take reasonable steps to ensure that employees, gymnasts and others on the premises are not exposed to risks to their health and safety. Each operator must embed controls and contingencies to prevent, mitigate and manage risks associated with infectious diseases into their standard health and safety practices. Each operator must update their organisational, activity and site-specific risk assessments and controls during times of infection pandemic where statutory guidance requests this. This is the responsibility of the operator, although tasks may be allocated to qualified staff and also to the external hirers using the facilities. Each operator must continue to consider all other legislation and regulation when developing controls and contingencies during infection pandemics. In the gymnastics environment, detailed best practice guidance has been produced by leading governing bodies within the sector, including British Gymnastics. Duty of the operator and external hirers. Employee rights. You have a right to feel safe and have access to an up-to-date policy which references health, safety and infectious diseases. You have a right to access safe systems in the prevention, mitigation and management of infectious diseases. You have a right to receipt of training. This may be through instructions, guidance or formal training and qualifications dependent upon your role. Employee responsibilities. You have a contractual duty to abide by your employer's policies and safe systems associated with health, safety and infectious disease. You have legal duty to look after your own and others' health and safety. You have a duty under the common law to take care of children in the same way that a prudent parent would do so. It is very rare for individuals to be prosecuted under criminal law with regard to health and safety of children and customers. Most claims for negligence are brought against the operator or employer who has public liability insurance and not individual members of staff. Notwithstanding this, external hirers and employees must be aware of statutory guidance, operator policy and practices, and must take all reasonable steps to prevent, mitigate, and manage the effects of infection within the context of their own role and responsibilities. Thank you for watching. Feel free to watch as many times as you need, or move on to the next part of your digital learning experience on your list.